Hi again. Well, teleorthopedics hasn't been widely practiced in Australia, and so we're often asked by specialists that are of a physical basis, what is the quality of care like for telehealth consultations versus standard face-to-face? I've had a look at a lot of the data. There's not a lot out there, to be honest with you, but I'd like to share with you one study that's come out of Norway in 2016, and it's titled Quality of Care for Remote Orthopedic Consultations Using Telemedicine, and I'll provide the link for you below this video excerpt. Now, the aim of the trial was to study the quality of remote telemedicine consults in an outpatient clinic compared to an ordinary consultation. And the hypothesis was as follows. The introduction of telemedicine service in the form of real-time video conference for the selected orthopedic patients will cause no reduction in the professional quality of the patient treatment administered by the doctor involved in the consultation. That it will also increase patient satisfaction and it will lower costs. It was a randomized control trial with two parallel groups. In the first group, video-assisted consultations were conducted at a remote or a regional medical centre, and that was the intervention group. And then on the other hand, the control group was a standard consultation in the orthopaedic outpatient clinic at the University Hospital of Norway. 400 patients were part of this randomized controlled trial. 199 of those patients were in the remote consultation group and 190 were in the standard consultation group. The orthopedic surgeons evaluated each of the consultations that they performed at the end of each consult by performing or by completing a questionnaire. The telemedicine that was used in this particular study was twofold, real-time video conferencing and digitalized x-rays. At the remote centre where the video consults were being held, the individual was alone. They weren't there with any other physician in the room. Now, the evaluation in this clinical trial comprised of answering a questionnaire that had five-level questions evaluating the response, or where the clinician had to evaluate a response as being very good, neither good nor bad, and then very bad. And it measured 5 levels of experience: cooperation, information, examination and evaluation, treatment, and overall evaluation of the consultation. So they had to assess each of these areas. There was then some secondary endpoints that looked at patient satisfaction and economic analysis, and that was also assessed via questionnaires, both to the orthopedic surgeons and also to the patients and to the centres involved. Now, the main finding of this study was this, and that is that the orthopedic surgeons evaluated the video-assisted consultations as being not inferior to the standard consultations. So specifically, while the sum score was lower, which means better, in the control group compared to the intervention group, so the orthopedic surgeons did class the face-to-face consultations as better compared to the telehealth consultations, the difference was in the non-inferiority margin. So what that actually means is that it was safe to offer video-assisted remote consultations for those selected orthopedic patients, and that there were no serious events related to that mode of consultation. There are some other studies that have been done in geriatric patients and a couple of other groups. I'll also include the links to those below. I guess the bottom line is not a lot of work has been done, certainly not in Australia and certainly across the globe, in terms of comparing telehealth consultations of a physical nature compared to a face-to-face nature. But given the current constraints that we're all now facing, where social isolation is going to be the key to constricting the impact of this epidemic, we now know from some of the data that the patient is not adversely affected, certainly in the personal injury sector, in terms of exploring or examining physical examinations. The expectation is around making comment and providing your opinion on what you can provide. You can't physically palpate, and there is no expectation around that. You can observe swelling, redness, stiffness. You can observe range of motion to a degree, and then beyond that, it involves all of your communication skills to talk to the patient about what they're exploring. We know though from this clinical trial at least that the patient was not adversely affected from a healthcare perspective by having their consult in the outpatient clinic being conducted via telehealth.